In this video, I'm going to be talking about everything mental health, and I'm going to be answering questions that can be quite difficult to answer in the mental health space. Some of these questions are things like, does social media affect mental health? What are some signs of mental illnesses, or even what is the best way to improve someone's mental health condition? My name is Emmanuel with Sandstone Care, and we are about to take a deep dive into this topic. So sit back, get comfortable, pull out your note sheet. Let's get into it. How are young adults being affected by mental health? Well, first we have to understand that mental illnesses or mental disorders are conditions that affect your well-being, including your emotions, thinking, mood, and behavior. And according to the Substance Abuse and Mental Health Services Association, in 2018, 8.9 million young adults reported living with mental illnesses. So how are young adults being affected? We are seeing that year after year that poor mental health conditions have become a growing problem amongst young adults as a whole. This is leading us to seeing more and more cases where students are having challenges in school or within their families and their friendships or even their own communities. And what's even more troubling is how we're seeing that these serious mental illnesses put young adults at more risk of suicide. The Centers for Disease Control and Prevention reported in 2019 that 1 in 6 youth reported creating a suicide plan within the last year. This is a 44% increase since 2009. So this is how young adults are being affected by mental health. And that's why it's good to have these conversations and to share this data so more people become more aware and more people can get the help that they need. The next question we'll answer is, what is the most common mental disorder affecting young adults? The most common mental disorders that affect young adults include depression, anxiety, eating disorders, attention deficit hyperactivity disorder, and substance abuse disorder. Depression is a mood disorder that negatively affects the way you feel. It causes you to feel more sadness and lose interest in things that you once loved to do. Depression can make it really hard for an individual to function daily because they also typically deal with symptoms like having trouble sleeping, low energy levels, trouble with concentrating or decision making, and even having to deal with facing suicidal thoughts. Before I describe the rest of these mental conditions, please know that if you are dealing with any of these symptoms yourself, towards the end of this video, I'll be sharing different treatment options and ways that you can improve your mental condition. So make sure to stick around towards the end of this video if you are looking for additional support. Now we're going to talk about ADHD. ADHD is a mental disorder that consists of symptoms such as an ongoing pattern of problems with attention, hyperactivity, or impulsivity. An individual dealing with this might find it difficult to listen to others or struggle with holding an attention span for a sustained amount of time. So for young adults that are still in school, when it comes to studying and learning their social life, you can see how ADHD can make their daily routine a bit more challenging. Next, eating disorders. Eating disorders are a disturbance in eating habits associated with distressing emotions. For example, anorexia and bulimia are more of the most common types of eating disorders amongst young adults. Anorexia is a condition that consists of self-starvation or extreme weight loss, while people with bulimia typically have alternating diets that involve eating low-calorie foods or binge eating high-calorie foods. Even though these are the two most common types of eating disorders, there are definitely more that we could talk about in this category. The last one we're going to be talking about here is substance abuse, which is a type of behavioral health disorder. Behavioral health refers to habits that impact your physical and mental well-being. So when it comes to an individual that is struggling with substance abuse, this means that they are unable to control their own use of substances, which normally turns into an unhealthy coping mechanism. Now, let's move on to this next important question. Why do young adults have worse mental health? Well, according to the National Institute of Mental Health, young adults aged 18 to 25 years old had the highest prevalence of mental illness compared to adults aged 26 to 49 and 50 and older. There are a lot of factors and reasons that play into this. The first is the transition into early adulthood can be a stressful time. People in their late teens have to become more independent and start making important decisions regarding their own future. It is very stressful making these challenging decisions and difficult choices. So because of this, many high school and college students may turn to using drugs and alcohol as a way to cope with all these emotions that they're going through. Substance abuse and mental health disorders have a direct correlation. So with this being said, we can see how all of these factors combined play a role in why young adults' mental health conditions tend to be worse. And before moving on, I do want to make sure that I add that there are even more factors I hadn't even mentioned, like inadequate living conditions, family history of mental illnesses, traumatic experiences, or even how much access someone has to support and resources. With so many factors out there, this is why it is important to continue to raise awareness and education upon the subject. This next question that we're going to discuss is, what are the signs of mental illness in young adults? With so many different signs out there, to better answer this question, I'm going to share with you 17 different signs in more of a bullet point type style. I hope you have your note sheet ready. Here are the 17 different signs. Sudden trouble in school, intense mood swings, lack of concentration, absence of motivation, isolating from friends or family, poor hygiene, irregular sleep schedule or struggling to sleep, no desire to eat or changes in their eating habits, self-loathing, excessive worrying, low energy, excessive anger or violence, easily irritated, defies authority, unexplained physical injuries, suicidal thoughts, and lastly, substance abuse. If you are struggling with any of these signs that I mentioned, or you know someone else that's struggling, I'm going to link up to a video right here, and the link will be in the description box as well, that you'll be able to click that talks about self-care tips so you or the person you know can begin to start to feeling better. This next question is being asked about a lot more year after year. How does social media affect mental health in young adults? First, I want to talk about how social media has made some positive effects in our society. It has made it easier for people to communicate with friends and family and keep up with other people's lives that we may not have ever met or seen or even talked to before. Even though social media's intention is to keep people connected, it has also created negative habits and behaviors that have been harmful and can affect people in a negative way. For example, social media has made it easier for people to spread rumors, and words can still hurt even though they're behind a screen. The appearance of someone's life on social media has also created these unrealistic standards. Social media allows people to paint a picture of their life that often highlights only the good parts and not the bad ones. And when they do post something from their life, it's usually manipulated in its colors and brightness, or even photoshopped. So when young adults start to compare their own life to someone else on social media, they're often comparing their life to an unrealistic expectation. And this can cause self-esteem issues and lead to anxiety and depression. Without getting into how social media can make someone spend less time outside or less time exercising and making real life connections, the most important thing to get here is that social media is affecting young adults' mental health in a huge way. And that real human interaction is essential in our lives because it helps to promote healthy physical, emotional, and mental well-being. Now that we've talked about and answered questions pertaining to mental illnesses and how it affects young adults, let's start answering questions about ways to improve someone's mental condition. So the first of these last two questions is, what is the best way to improve a young adult's mental health condition? Here are some ways. Educate yourself on mental illnesses. Be more open and non-judgmental when talking about mental health issues. Become more aware of the warning signs so that way you can help better notice when something is wrong. Promote healthy habits like eating a healthy diet, getting quality sleep, staying active, and taking breaks when needed. And lastly, limit time spent on social media. All of these different ways have shown a positive impact in improving someone's mental health condition. Now, even though these are all great ways, the best way to help young adults with their mental health problems is to get rid of this stigma that comes along with it. A lot of people may be scared to talk about it or even get help because of this fear of being judged. But the more people that talk about it openly, the more comfortable people may feel about getting help. So continue to work on growing in your understanding and keep having these open conversations about mental health because it can truly help make a huge positive impact in someone's life. And now, the last and final question that we're going to answer here is, what is the most common treatments for mental disorders in young adults? Mental health treatment comes in a lot of different forms like psychotherapy, group or supportive therapy, and also medication. Psychotherapy, which is also known as talk therapy, is one of the most common therapy treatments. This is where we get into treatments like cognitive behavioral therapy, dialectical behavioral therapy, psychoanalyst therapy, and more. In terms of group therapy, we're talking about 5 to 15 individuals that meet with a psychologist for about an hour twice each week. Group therapy may sound intimidating at first, but it offers such a great support network and a chance to listen and relate to others that may be going through similar experiences as you. And lastly, when it comes to medications, talking with your doctor about antidepressants, anti-anxiety medications, or mood stabilizers could be a helpful treatment option. I do want to stress here though that no single treatment option works best for everyone. That's why it's important for you, if you are considering treatment options or know someone else that is considering treatment options, to discuss this with a mental health professional. This way, they can help determine what is the best mental health care plan for you. Now, if you made it up to this point in this video and you've taken your notes and you find that after hearing these answers, you struggle with a lot of these different things yourself, it is so important for you to know that you are not alone. Sometimes it may feel impossible for people struggling with mental disorders to feel like they can get the help that they need. But here at Sandstone, we'd be happy to help you find the support that you need and the resources that you're looking for, even if it's not with us. We do have inpatient and outpatient treatment programs for individuals dealing with mental health challenges, addiction, and substance abuse. And we have mental health professionals that you can talk to right now if you have any other mental health needs, questions, or concerns. So if you'd like to talk to a Sandstone Care member right now, you can live chat them at sandstonecare.com or call them using the number below. You'll definitely leave the conversation having your questions answered. All right, I hope that this video has been a helpful resource for you. And if there are other topics that you'd like Sandstone Care to discuss, just leave a comment down below and you may see a video on the topic that you suggested. Thank you so much for your time. Have a good one.